Hi, welcome to my channel. I'm Dr. Sridhar. One of the recent concerns we have is obviously what's happening in the United States. President Trump's team looking at the McCullough report on autism risk factors or the triggers for autism. All of us are familiar with the increasing risk of autism, and obviously we're all worried about it. We do see a higher number of cases, so part of it is because we are more aware, we are more sensitive to it, and we are diagnosing more, but that's not the only reason. Obviously there is something going on in the past 20-30 years that we are seeing an increasing number, and it's not a good trend. And obviously there are so many things happening that we cannot pinpoint. Even this report acknowledges that it's multifactorial. We have genetic factors, we have prenatal factors, we have maternal factors, the delivery related, the antibiotic use, exposure to medications, and they have mentioned exposure to vaccines as well. So I had made an earlier video on paracetamol and the link to autism, the maternal treatment with paracetamol, and obviously even though that's an association and not a causation, it still makes sense to avoid or reduce the use of paracetamol where it's not essential, and when it is essential, use it in a sparing way. So that's still the safest antipyretic analgesic to use in pregnancy. So don't go away from go away from using it fully, but in terms of reducing its usage and restricting its use to when it's needed, strictly PRN basis, it's very important to follow that. In terms of vaccination, obviously it's a very big challenge because we have made huge advances. I'm a pediatrician, so obviously I'm not going to claim I'm not biased towards vaccines. I'm not an anti-vaxxer, definitely. So if you look at the infant mortality rate in the 1990s, when I started training, the infant mortality rate in India, for example, was in the 80 to 100 range, and now it's 25 for the country, but there are states in India which are performing well where it is in single digits. All over the world, in the developed countries, it's in the 5 to 10 range, and in the developing world, most of them are in the same range of India, like 25, 30, in that range. So it has made a dramatic change from 120s in the 80s to 25 now. It's not all related to just vaccines. Obviously, nutrition has improved a lot. Malnutrition, we don't see the kwashiorkor and marasmus, the severe cases we used to see. Hygiene has improved a lot. Awareness of hygiene has improved a lot. Safe potable water supply is available to most families. So waterborne diseases like cholera, which used to be deadly and used to cause many deaths, have gone away almost. And thankfully the awareness of rehydration and so on has improved as well. The resistance to infections, appropriate treatment, availability of physicians to treat. Previously we used to have compounders who used to treat not qualified physicians in the rural settings, and they used to treat as they wanted, and many people didn't come to allopathy as well. So access to medications, timely use of antibiotics. The World Health Organization has done a great job in improving awareness in diarrheal diseases and vitamin A deficiency, respiratory infections, early treatment of pneumonia, even in the community level. Of course, maternal mortality and infant mortality